Welcome to my party.
And I'll cry if I want to.
Rise and grind. Come on.
Huh?
Give me a funnel, please.
A funnel?
Yes. Hold off on that. Do it in the back.
You got for the other room? I have some funny things to tell you offline.
Alright, good morning everyone. Thank you for joining us this morning. We are here in San Antonio, Texas with Dr. Jeneby. He's currently doing some butt implants this morning.
Oh my God.
If you guys have any questions, feel free to ask in the comments below and we'll do our best to answer those for you. If you're interested in scheduling a consultation, you can do so by either filling out this get a quote form if you're watching on our TikTok,
Hey, Art.
or if you're watching on our YouTube or Instagram, you can send us a DM on Instagram with your best contact information and which procedures you're interested in getting. And if you're interested in seeing the full procedure being performed this morning, you can head on over to our YouTube channel. That link is going to be in our bio in the link tree, or you can look up Dr. Boom Boom Pow on YouTube.
The manufacturer does want me to try Breca. What funnel?
What's the name?
Breca funnel.
Did you see them this weekend?
Yes.
Yeah.
Alright. Left implant, size 3, 400 cc's, expiration 9/19/2027, left implant.
Tracy, do you mean like how long do you have to wait until you can lift anything after getting implants? Or like, are you talking about wanting to get a lift when you do get your implants? So when you do breast implants, you can do the lift when you get the implants. When you do the implants and get the lift, they will sit higher, but also remember that they will settle into place, which usually takes about a year for them to fully settle into place. Do you already have implants and recovering from that surgery and now you're wanting to go back in and get a lift? Um, 6 months to a year. It depends on how well you're healing. And it depends on your doctor as well, like what your plastic surgeon recommends.
Mission Park.
How long ago did you get your implants, Tracy?
had to get out of my car to get a sandwich because I was hungry. I was like, oh man, they're not gonna have any food here, right? So I got like a little pour protein.
Okay, so I would wait at least another 3 months before talking with your plastic surgeon about getting the lift and scheduling that surgery out.
Slum it. Slum it. All right. Cable up, doc. You know.
No worries, Tracy, you're welcome.
Listen, I think I see a corkscrew behind the anesthesia. Oh man. Did you get it, Doc?
I'm gonna try.
No, just I'll let it get it. Don't hurt yourself.
No.
That means they didn't count. What was that time where? Oh, that's good.
Tracy, this procedure is a butt implant.
It's not a corkscrew, it's kind of like an adapter of some sort.
It looked like this. It looked like this.
Not yours, right? Nothing I've seen before. Probably trash.
For you or?
Yeah, you need to put your arms straight.
Is the first sprayer working?
We call that
Do it. Show it. That's correct. Had a really good talk today with private equity.
yeah.
Said, we need a sprayer.
I'm gonna pass off this.
Yes. And I said, include my boys in these deals. They're like, that's a good idea. I'm like, thanks, I came up with it.
I would wait to do any other surgeries, so like since you had the BBL already, I would wait to do it at the same time that you want to do your breast lift and get them done at the same time.
I just convicted it right now.
That way you can get them done all in one go. And if you have to take less time off work.
That place got busy back in the busy week. Good week. It is. Feels good. I gotta pay bills. Right. So we're working together.
Yeah, we kinda didn't need that.
See how they put together without them showing off.
Yeah, then they could say, hey, it's a luxury, you know? You're a resident, you learn to work with whatever you have, right? And also, hold this here. So May 16th for us.
Yes, cash is good. Dr. Name is available.
And then Blue Prime again?
Yeah.
All right.
Or you wanted to add Freddie, so it's 15.
Yeah, stay. Gotta have Freddie in there. He'll get bun hurt. I didn't tell her I wouldn't go.
What's the best thing you had this weekend?
Appetizers. Had this bison carpaccio. You would think it would be dry, but it's actually really kind of tasty. Then I had really good sushi actually. Yeah, next year you get to go to an international. That's where I'm going to take you. So, we have something. Second verse, take us the first. Watch all this. There's a chair over here, man. It's gonna kind of get in your way. I'll push it on there.
Dr. J, did he have butt implants before?
He did have implants before.
Oh, okay.
These are his new ones.
Okay. But they were already removed?
Yes.
Okay.
Oh, that vaser one we did really helped with that flame. Hey, Doc, do you have the pedal on your end? Thank you, sir.
I'll step on the floor if you want.
Yeah, go ahead.
I believe it's at least 2 weeks, 2 to 4 weeks before you can sit on your implants. It's the same with a BBL. And Dr. J requires his patients to get a bidet when they do
Yes.
butt implants.
Why do you think we make them get a bidet? Anybody audience answer that? Because you gotta keep this area clean.
Yeah, it's just to help.
I'm gonna wipe your butt for you. That's mom.
The bidet really helps avoid any infection.
That was a mentor thing, right?
What's that?
This weekend was a mentor meeting?
No. I met the director of sales for the whole US. Her name is Sandy. That's the three girls. I mean, I was like, why don't you just discount once a year? I told her. Like, you know me, I'm up there. It's like,
What was it, aesthetic show?
yeah, the aesthetic show. Make sure
Yes,
it's an
Tracy,
option.
definitely get one. You can get one for your toilet. If your shower's close enough to your toilet, I believe there's even one that you can hook up to your shower and have the cord from the shower to the toilet. But yes, get one. Whether you get a BBL or you get butt implants, whatever it is, to help avoid any infections, get the bidet. Because you want to make sure that whole area is nice and clean, because the where your stitches are going to be, where they're inserting it, is right on inside the crack.
Oh no, I don't think you're there. MCA. I love it.
Had my girlfriend was crazy with it in the army. She worked in combo communications. They used to have the saying, "You talk shit about it, you can't talk shit without it."
Interesting. Well, another favorite saying is, 100 years is because, right?
Tracy, good question. Let me double check. Hold on.
Apparently called Mike Jeneby. You trained him to do that. Yeah, it's some weird stuff, dude. Is it like a full moon?
No, it wasn't. 'Cause I was out on the river all weekend.
Okay.
Did you call me?
Nope.
I do need the seat for my meat, though. Maybe not. Actually, I'm from it.
Is it not over there?
All right,
we
what?
moved it.
I got another one. What's up?
What material is the butt implant made out of? This one? Do you know?
Ooh.
That's what I was thinking.
Dr. J.
High density silicone.
High density silicone?
Yeah, silicone.
Okay, that's what I thought. I just wasn't sure. Someone asked.
Density silicone, exactly. They're solid. You can't have a gel. You will sit on it and rupture it, right?
Yeah. All right, Tracy. So it's a high density silicone.
So going to Mexico, they can use.
They just do implants.
So it's a little different than the breast implants. It's not going to be as gummy. It's going to be a lot more stiff. You okay?
Yeah, yeah.
Well, or Charles.
You want like that?
Like it.
Okay.
Ready to do the drain?
I got another shot for you.
To seal.
Yeah, because if you think about it, you don't want to sit on it. If it's gummy, you want it to be a little bit more firm. Here, I can kind of show you the implant. Let me take the phone off the tripod. Hold on.
Long time ago when we first started putting it in. Interesting.
So that
Good stuff.
is the implant.
How much time vaser on each side, Doc?
Oh, 2.5 minutes.
2.5 minutes?
You have the size, they have a different kind of a weird sizing.
Yeah, I got the sizes.
Yeah, it's kind of, you have to
Size
take it all
3s,
out.
400
Size
cc's.
threes. I got it. Don't put mine in, you know.
Got to hook up to.
Good morning, Lisa.
Oh, okay. Couple of girls that know that this thing exists next door.
And then I know you can't really see it now, but you can kind of see where Dr. J has marked
There's some thinking up in here.
with that purple circle. That's essentially where the implant will sit. And it'll sit in between.
Check on Crystal today. Sent her, I gave her one of the suture kits last week.
Oh, okay.
Taught her a couple different sutures.
Yeah, because I guess she went to the Sioux Nation. Everybody needed to be sewed up and she didn't know how to sew. Like, because I probably don't want to do that anymore. Like I told you.
Lisa, thank you for the gummy bear.
Right? You don't kind of, not that you lose it, but you don't want it. All right, first implant is in an implant funnel.
So same way they do the implants for breast.
Breast.
And you're going in between the muscle, correct?
Yes. Called intramuscular technique, which only about, not many people do. I don't know the exact number. You either go above or below. This is harder to do, obviously.
Tracy, really it's your choice. I know Dr. J talks about how he likes the look of the implants a little bit better than a BBL, because with the BBL, over time that fat that was moved to your butt can still break down, like if you continue to lose weight. The fat cells also, after transferring the fat to your butt, some of the fat cells might die. So it really just depends on what your preference is and what the look you're wanting to go for. The BBLs are definitely a little bit easier for post-op care. The butt implants, a little bit more tough just because of the higher infection rate, but that's once again why you get the bidet.
Why you listen to Dr. J. Why you don't go back to work early.
Yes. And Dr. J makes sure that all the patients have proper protein, proper vitamins, proper medication as well, because keeping up on your protein and vitamin intake helps you have a smoother recovery. Not necessarily quicker, but definitely a lot smoother. Want to make sure you're giving your body all the nutrition that it needs in order to heal your body properly. So you can see Tracy, they've only done the left implant. Let me take it off the tripod here for a second. See if I can get you a better look.
There's one side, you can see it, how pretty it is.
So the butt cheek closer to us, the Dr. J's now in front of, that's the one that just got the implant.
Hey, you can see the difference now? There's before and after, really. Before, after. Before, after.
Crystal, these are butt implants.
Couple miles.
Yeah, the look is definitely a little bit more permanent for sure with instead of doing the BBL, just because that, like I said, that fat can break down and die from the BBL, or if you continue to lose weight after, you might lose a little bit of the weight in your butt too.
Yeah. That'll go down here.
And if you've already gotten a BBL, you could go in later and do implants after, you know, your doctor clears you to get your next surgery. And there's different sizes of the butt implants, just like the breasts too. Like there's not just a one size fits all. Thank you, Fit Dad, for joining us.
Good Dad's in the house. Good Dad likes us.
Fit Dad, we are on YouTube right now if you want to join us in there. And then we'll be on YouTube again later today for a tummy tuck. So I know you usually always watch on TikTok, but last week I know you came in on the YouTube for a little bit, so I just wanted to let you know. Oh, good. I'm glad that you're on YouTube. Thank you for watching on both platforms. We really appreciate it.
Okay. Implant number
Spray
2 going in.
first. Spray first.
Oh, right. Yep.
Ice implant coming up in the next couple weeks too, right?
Apparently they sanctioned it now.
Yes. Is that like a for show kind of thing?
It was exhibition, but I guess they went ahead and sanctioned it. Like, what are you gonna sanction it?
I don't know.
Not for the heavyweight title. He hasn't fought a heavyweight.
You haven't thought ahead of it.
Welterweight, old weight, money making weight. Implant bag on the floor. Okay, let's start closing. up now. Is there any questions out
Hello. Thank you for joining us on our Instagram. Alright guys, Dr. J is closing up right now. So we'll only be on for a little bit longer, but we'll be back later for a second surgery. And then between surgeries, we're going to try and get on our TikTok and do a TikTok live Q&A.
there? You want to do a live Q&A with you? You want to set up?
Yeah, I can set up.
Oh, see in the back?
Alrighty guys, I'm gonna go set up for a live Q&A with Dr. J when he gets out of surgery over on our TikTok, so don't forget to come back and join us, and we'll see you later.